First of all, I have patients from all over the world because there are not enough providers that treat this illness. And 100% of the kids that I see have PANS, is the acronym, Pediatric Acute Neuropsychiatric Syndrome, one kind of which is PANDAS. So in PANS, what happens is there's this acute, meaning sudden or overnight or rapid change in the neuro or psychiatric functioning of that child, their behavior, their moods, their emotions. There are a lot of symptoms that we can talk about, and it happens relatively suddenly. Sometimes parents have a date, a specific date. My child, I can tell you, July 7th, 2006, that was the day that he became like a completely different person. It took a long time to figure out what happened to him. So that is 100% of the kids that I treat. And then they come in and I try and figure out why. And so when you're looking at PANS, there are two major categories to look in. One is immune or infection triggered. For example, a child could have encephalitis from a virus or Lyme or a Lyme type of infection or meningitis, right? That can cause brain inflammation. And those are the symptoms you're going to see, a change in their behavior. If you ever read that book, Brain on Fire, it's a perfect example of somebody that was functioning just normally one day and then began to have drastic changes in her personality and her ability to think and perform at her job. And those are the kinds of things that you see in children. Only in children, they're not able to language them very well. So very often a parent will see something happen. All of a sudden their child has a lot of worries or they're asking a lot of questions. You know, is it okay if I touch this? Is it okay if I go there? Or, you know, are we all going to die? Or whatever their intrusive thought questions are. Or sometimes they will suddenly become afraid to touch things or afraid to swallow, or they'll stop eating, or they'll be afraid things are contaminated, or just their anxiety or OCD, and they'll have to start counting, or something will happen that's really big for them. The parent takes the child to the doctor or the emergency room, and there's a really good chance that they've never heard of PANS. And it is getting better. But most of the time, the parent takes the child into the physician or the therapist or the emergency room, and they just say either it's a psychiatric problem, or your child's under stress, or they need more discipline, or they're being, you know, really obstinate, or there's a parenting problem, or maybe a school problem or a behavioral problem. And they either wave it off and they say it's a phase, or they say take him to a psychiatrist, or they say he needs psych meds, discipline, or detention, or parenting classes. That is the majority of the time. So a lot of kids end up kind of lost in a maze. And once they go down the psych med pathway, they can be lost in that maze for a long time, because if this psych med doesn't work, then they try that psych med, and if that doesn't work, they add another one, and if that one doesn't work, then they add a third, or they go up in the dose, and it could be a lot of suffering and a lot of time gone by before somebody finally says this is not working. Usually by the time they come to me, that parent has done a lot of homework. Either they, in the middle of the night, you know, found PANS or PANDAS online, and they're like, you know, it seems to fit the criteria, sudden overnight change. There are also physical signs, very often a decline in school, cognition, memory changes, coordination may change, developmental regression. There are a lot of things that you can see. The research is really just unfolding. There's not a ton of research on causes. And what's very, very interesting, you could have immune trigger or infection triggered PANS, but you could also have metabolic. You could have environmental. Somebody gets exposed to arsenic, or a little kid goes in the garage and they're playing around in the chemicals in there, or they get under the sink, or they have diabetes, right? That can cause brain change, or another type of autoimmune illness, or maybe they were next door and they were spraying in the pesticide fields and they're just loaded with pesticides, which are all neurotoxins, right? Or maybe they're in a moldy, toxic environment. So there's a lot of different pieces to sort out. There's the, immune or infection triggered and the non-immune infection triggered. So, and they're cumulative. They're also doing research to find out more about why one person might get it. But one of the things that I really see is that even a child who is perfectly healthy and robust that ends up having PANDAS, like high functioning, happy, active, excelling in all different phases of their life. And then the next thing, they're so psychiatrically ill they can't even leave their room. Most of the time, what I see is that there was some underlying already immune stress or trigger or something going on that allowed that to happen, because everybody in the whole class and even in the whole school and probably the whole community got exposed to that exact strep that week or that month. In any given flu season, they might say, oh, the flu this year is really, really bad. So people that are the most fragile, the elderly, the sick, the younger people, they need special attention. Like they should really be sure and get the flu shot this year because this infection is so big, it could take them down. I think there's something like that with PANDAS too, that a strain of strep that's called a rheumatic strain, meaning it's able to do this molecular mimicry where it's able to hide out in the body, right, and look like a person's cell, trick the immune system. So at any given year, there may be a particularly rheumatic strain of strep come through. And the people that are the most sensitive, fragile, or susceptible, or maybe already sick, maybe already had a bunch of stuff going on, maybe they live under tremendous pressure, maybe they have a moldy environment, maybe their allergies are bad that year, they have sinus infections, and on top of it, the strep comes and their system just can't even handle it anymore. I just feel like in many cases, there's a matter where the vessel is just so full, there ain't no room at the top. And for me, that's part of how I work with kids. Like I look for the biggest trigger, like say the PANDAS, strep, but I'm also going to look at other more chronic infections or gut disruption or food problems or other allergic phenomena or anything else, so that I can really clear out everything that I can identify at least. Our medical system has limitations. In 2015, there was a really good study that came out with Johns Hopkins, their encephalitis center, and they looked at about 240,000 cases of encephalitis in the United States between 2000 and 2010. The majority of these were hospitalized, really, really sick patients. They had every possible test available to the medical community, and 50% of the time, they never identified the cause of their encephalitis. 50%. And this is with our best medical technology, and so their conclusions were, we have a real knowledge deficit here. The problem is not the patient. The problem is our medical system. We simply don't have the full technology to identify all these causes and all these bugs or infections or mechanisms by which we see things like acute encephalitis. But we still have to treat it. Still can't withhold the treatment because they haven't fully identified the cause. That's part of the problem that we come up with in PANDAS.